The Centers for Disease Control and Prevention has issued a health advisory over a rise in the Parvovirus B19 virus. So joining me now to talk about this is Dr. Magdalena Sanz-Cortes from Texas Children's Pavilion for Women. Thank you so much for coming in.
It's a pleasure.
So for people who don't know about this, tell me what this virus is, because they probably heard about it more from their pediatrician than from a fetal medicine expert.
That's right. So Parvovirus B19 is a respiratory virus that mostly affects children. However, one of the risk factors to develop like severe forms of the disease is if it affects pregnant patients. So that's why as maternal fetal medicine specialists can be involved in this situation.
That's why we have you here. But I think a lot of people probably have heard about this because it gets really common among children. And one of the other reasons to be concerned is because school's back in session. So it's probably going to start going around, right?
That's right.
It's that virus that looks like they've been kind of slapped in the cheek, right?
That's right. You got it. That's the most typical sign of the disease. However, whenever children are presented with that rash that is very specific, they're typically not that contagious. Before that situation of that rash, about 7 days prior is when they start developing some mild fever, some muscle pain, etc., and that's when they're mostly infectious.
And so how is this virus transmitted? Is it just like every other like cold and flu type virus?
You got it. Respiratory droplets.
Okay.
So same precautions as for flu, COVID, etc.
And so is this a big concern if, say, a mom is pregnant and has a school-age kid?
Yes.
Is that who should be most concerned about this?
Yeah, so if you are pregnant and you have another child who's going to daycare or is going to kindergarten, really the age group that is mostly at risk is from 5 to 9 years of age. That's the group that is most common to acquire the infection. If you are pregnant, but also if you have children in the house, or if you work in a daycare, if you're in contact with children a lot, you would be at high risk to acquire this infection.
Yeah, and why is it so scary for a woman to get this infection, a pregnant woman to get this infection?
When you're pregnant, most women, when they're pregnant, they are immune to the condition. About 50% of patients by 30 years of age, they have been exposed to the infection already. But there's half of the population at that time that they might not be immune. So when you are pregnant and you're not immune, it's the first time you acquire the virus, it can cross the placenta and it can affect the baby. And if it affects the baby, it can be potentially severe. About 40% of those cases, baby could develop anemia and even could die. So it's a very significant concern.
That's really scary. So 50% of women, maybe they had this in childhood even, and they just have carried the immunity with them their whole lives?
And they should be okay.
Wow, that's fascinating. So if somebody does get it and it becomes a severe infection, how are you able to treat it?
So if we detect that the baby is anemic, we have a way to treat that fetal anemia by giving blood into the umbilical cord, or the, we do it different ways, but for the most part in the umbilical cord, into the baby. So we give blood to the baby, yes.
Wow. And how long is a procedure like that? Is it risky to do a procedure like that?
It's not that risky. It's one of the most common interventions that we do during pregnancy. And it typically takes about 20-30 minutes.
Yeah, as a health reporter, I find it fascinating. But as a mother, I would be terrified to have to do something like that while pregnant.
It's a very simple procedure. It is under just sedation. We do it in the OR. Typically, it's very well tolerated. There's a little bit of risk for the baby, but for the most part, it goes well, and complications are very exceptional.
Okay. Before a woman ever gets to that point, what would be the signs and symptoms that something is wrong, that maybe she has this?
If you're pregnant and you have other children in the household, or you have interacted with other children who have been diagnosed with parvovirus, you need to talk to your provider, to your pregnancy provider, and let them know that you might have been exposed to Parvovirus B19, so that they can do lab work and they can do specific ultrasounds to see if the baby is affected or not.
Okay, so is there anything else that they should do to reduce their risk if a child comes home with this virus?
Yes, so same precautions as any respiratory virus, such as be very mindful of like hand hygiene, using masks if somebody's infected in the house, not sharing spoons and forks, which is very common for moms with toddlers sometimes. Those are the basic recommendations.
The number from the CDC that I had read this morning was like over the last 2 years, there was a 3% chance of this virus. And then just in June alone, there was a 10% chance.
That's right.
Why? Why the sudden increase?
We think that it's just part of the fluctuations that we sometimes see in viral infections. We don't really have an explanation of why it's so high right now.
They just come in those weird patterns sometimes.
Yes.
And there's really nothing we can do but be aware of it.
That's right.
Okay. Have you seen it at Texas Children's? Is it happening here?
I mean, Parvovirus B19 is a virus that we every once in a while see in our practice. It's not a new virus or anything like that. But we're starting to see a little bit of a trend of patients who have younger children in the house who are pregnant and they come for surveillance.
Is there anything about this that concerns you? Are you worried about this?
I mean, as long as the population is aware and they talk to their providers in case they're at risk, I think that we have a treatment for it, so I think that it should be okay.
Yeah. Any other things that you see happening among pregnant women now? Is there anything else that they should be particularly concerned about? I don't know, maybe with school starting or with COVID being so high. What would you recommend?
There's just a few viruses and other infectious agents that can cross the placenta and affect the fetus. Parvovirus B19 is now on the rise, and that's why we're talking about it. But there's another one called cytomegalovirus, or CMV, which is a cold virus that is transmitted in the same way, that is also common in babies in school-aged young children. So those two, I would say, that are the ones that I would be more concerned about as the ones that can infect the fetus.
Okay, so all things that women should be having a discussion with their doctors about.
That's right.
All right. Dr. Magdalena Sanz-Cortes, thank you so much for coming in. Anything else you'd like to say before I let you go?
I think we covered everything. Thank you so much.
You're awesome. Thank you so much for coming in. We appreciate that.